Madam Speaker.
Gentleman from Calvert.
Thank you, Madam Speaker. I do have a couple of questions for the floor leader, if I may.
Vice Chair of the committee.
Yes, sir.
Good almost afternoon. It's still morning, barely. I'm curious, since the bill deals with qualified resident, and it says here in the bill with respect to health insurance, that it means an individual, including a minor, regardless of their immigration status, correct? So in other words, they're not here legally in the United States or Maryland, is that correct?
Are you talking about a minor who's going to buy insurance?
Just talking about what the bill covers.
The bill, yes, here in Maryland.
Okay.
Yes.
All right, so it's a yes. So my next question is, do we know how many people would be affected by this bill? How many people are here illegally who are going to take advantage of this particular insurance?
The best guess of the number of people who could potentially be eligible, depending on income, because remember they're paying full price, is around 112,000 people. And that is a number that's derived from the Maryland Health Benefit Exchange when they look at the total population, how many people are enrolled, et cetera. So that's the number that they give us.
Do we know how many people?
In terms of who would actually take advantage of the program, we really don't know, because it's really going to be income dependent since they have to pay the full premium.
Do we know how many people are in Maryland now illegally? In other words, they're not citizens of the United States.
We think there's probably around 250,000.
Okay, because I was just reading, and it wasn't, a right-wing or left-wing paper. It was, they're thinking more in the 400 to 500,000 range and increasing every day.
So
Does that sound about right?
I apologize. I was referring to the number that we think are uninsured. So.
But we don't know.
We don't know.
So it could be 400,000 people to 500,000 people and growing.
I can't answer that question.
Okay.
Yeah.
So then my next question for you, and I do appreciate the answer to the question. My next question for you is, there is my understanding is, and my personal experience has been, and colleagues, even in this body, has been that it's very difficult to get an appointment with a doctor, even a primary care physician in the state of Maryland. How does this bill address that?
The bill addresses allowing people to get health insurance. That's health care. That's what the bill addresses. As I said, we don't know how many people will be able to take advantage of this program, but that is, we think that it would be across the entire state, and what you're addressing is a workforce issue. We need to work on that workforce issue now.
So
there are other ramifications for not having health insurance. It's the people who don't get preventive care or primary care who are ending up in our emergency rooms where we have the longest wait times in the country.
But we have the longest wait times in the country actually for a lot of different areas of medical care, and I'm just trying to figure out, why wouldn't you solve that problem first before bringing in maybe 500,000 people and growing onto a healthcare exchange when you don't have the doctors to support the citizens of the United States who live in Maryland already?
I don't anticipate it being a huge and significant number of folks who are able to take advantage of this, again, paying full premium. But I would suggest to you that if they can get primary care and preventive care, they won't need the specialists that we have difficulty right now. And you're right, sir, we in HTO are very cognizant about the workforce issues, and we see bills all the time about how we might address that.
So when you go to see your primary care physician, do you know how long it takes to see in Maryland on average a primary care? So in other words, you call or you sign up online. Do you know how long that wait is now to be able to see someone just for your primary care physician?
I can't give you a number on
in Calvert County, it's weeks. And then you go to your primary care physician and then the primary care physician says, you now need to see a specialist. And I know we've all been there. And if you haven't, believe me, it'll happen sooner or later. Do you know how long it takes to see a specialist when your doctor gives you a referral?
I don't personally know.
It can take months or less, possibly, but it certainly is not going to take a few weeks, probably a month at least. And I'm just curious why the committee felt it was okay to provide health insurance to people who are not citizens of the United States when the citizens of the United States that live in Maryland that built these hospitals and put this medical system in place can't even get medical care themselves.
The committee believes in health equity, and as does this body. We have voted in a commitment to health equity, which means all of the people who are living here in Maryland. Right now, the federally qualified health centers are ready to to help those folks who can take advantage of this program. And again, I would suggest if you have ideas about how to improve our workforce, our healthcare workforce, we are open and ready.
Thank you. Thank you for answering the question. So, Madam Speaker, on the bill, the term health equity is meaningless if you can't get access to a doctor. Absolutely nonsense. And that's the experience that we're having throughout the state and certainly in Calvert County. I just do not understand why folks believe that when you're a citizen of the United States that you should get into a queue behind folks who are not citizens of the United States. And I want to make very clear about something. I'm married to an immigrant, a naturalized citizen. Her father was a doctor, and he worked in the ER, and we would visit him all the time. And this problem, of course, did not exist back then. And all we're asking is, if you want to talk about equity, equity is when you treat the people who are here, who are American citizens, respectfully by giving them the care that they're paying for because they built these hospitals. And for all those reasons, I'm voting no on this absurdly ridiculous bill. Thank you.
Chair of the committee.
All due respect, this is not a ridiculous bill. The Health and Government Operations Committee, like all the other 5 committees, are very thoughtful. And when we make decisions listening to both sides with respect. And I have always given you respect, so I expect the same. That being said, in Maryland, and I want to give you a little history, before the ACA, Maryland had more than 756,000 people that were uninsured. After we adopted the exchange and we expanded Medicaid, because we were one of the first states to do that, our uninsured rate went down by more than 50%. So for the first time, all 23 counties in Baltimore City, 24 jurisdictions, people had insurance. And they had policies that were affordable. Then we discover on the Health and Government Operations Committee that there were people in the individual insurance market that were paying a lot of money in their premiums. So what did we do? I introduced a bill with the support of this body, because it takes more than one of us, it takes a village. They created a reinsurance program. Whether you agree with it or not, I respect you for that. But that bill brought in more than $1.2 billion to stabilize that market. For over 5 years, we have been able to keep premiums stable. In addition to that, the Health and Government Operations Committee didn't stop there. We decided, wait a second, there's still young people that cannot afford it and are not insured. So what did this body do? This body created a subsidies program, a pilot program, and you will see next week a bill, a follow-up to that, to allow and help young people pay for insurance. Some of them pay less than $200 a month because they're healthy and it helps the pool. But we didn't stop there. What did the ACO committee did? It also we put in a bill to create a check the box. When you file your taxes, there's a little box there that came from this body. And it says, do you have insurance? And if you don't have insurance, may we connect you to the Maryland Health Benefit Exchange, which is our public exchange, which has navigators, which speaks over 200 languages, and makes the navigation easier because there are hundreds and hundreds of products that the private sector cannot handle. We have been able to cover people through that as well. So who do we have left today that is uninsured? I don't want you to think about 500,000. The sky is not going to fall. We have left 350,000 people presently, 6%, right, from 14% that are uninsured. 250,000 of them, approximately closer to 256,000, are undocumented. So as a policy committee, we decided, where are these people going to get their care? You know where they go? They go to the emergency room. Maryland has the worst emergency wait time in the entire nation. And I don't know about you, but I went to the ER for my little finger. And when I went in there, people were sitting on the floor, on the chairs. It was overwhelming. So as a policy committee, I always ask, why is this bill being introduced? What is it going to do? Who is it going to help? And it's a balancing act. It's going to help all of us at the end. Healthcare is not free. Whether people pay for insurance and that pays for their care, we end up paying, all of us. Now, I want to make sure and be very clear about what this bill does. Please don't speculate. Let's stay with the truth, with what the bill does, with what's in front of you. Do not speculate. This is what the bill does. It saves us a lot of money because guess what? Hospitals last year spent anywhere between $120 and $150 million in uncompensated care. Uncompensated care. Not only that, we also have people that are not getting their care, that when they end up going to the ER, it costs a lot of money because you're not spending money on prevention. In addition to that, let's be clear. Please don't speculate. I want to be absolutely clear. Do not speculate. They will be paying full freight with their hard-earned money. Their hard-earned money. No subsidies. Again, no subsidies. And they're paying Maryland taxes. In Maryland, we had, the year before last, 89,000 people. They file with their ITIN number that is given by the federal government so they can work and pay taxes. That group of 89,000 pay over $140 million in taxes to Maryland alone. And guess what? Because I want to be clear, I don't want you to speculate. I have more respect for you when you don't speculate. Just stick to the bill. You know what happens with those people that pay $140 million? They don't get those state programs that can qualify for social services. And $40 million in taxes to Maryland alone. And guess what? Because I want to be clear, I don't want you to speculate. I have more respect for you when you don't speculate. Just stick to the bill. You know what happens with those people that pay $140 million? They don't get those state programs that can qualify for social services. And they even pay for unemployment insurance and they can't get unemployment. And they are helping who? All of Maryland. Because that money goes into the general fund. So as a policy committee, please don't say it's ridiculous. that is offensive. We were thoughtful. We may not agree as a matter of philosophy, values, but in my value system, covering people who are here, it is preventive medicine, cheaper when it's preventive, and it helps all of us. This is not free, not free, not free. Thank you.
Madam Speaker.
Gentleman from Calvert.
Thank you, Madam Speaker. Page 7 of the bill, line 20. If the General Assembly authorizes funding to subsidize premiums under the program. So I was reading that, and then of course, I noticed the chair of the committee did not address the real problem, which I discussed, which is the lack of doctors in the state and the amount of wait time it takes for the citizens of Maryland, who are citizens of the United States, to see. That is a very real problem. It's a very real problem in Calvert. It's a very real problem with everyone that I speak to across the state. And I'm allowed to have free speech.
Absolutely.
So, and you are too. So the words "don't speculate," that's inappropriate. I can say what I want on this floor. I was elected
Gentlemen,
by the
stick
people
to
of Calvert
what your
County to do
issue
it.
is,
This is the
please.
issue, Madam Speaker. This is an important issue, the issue of free speech on this floor. I will not yield free speech.
You
ever.
said it several times.
Thank you.
You have anything else to add?
Yes. And what I'm going to add is that the citizens of the United States deserve to be in the queue for the hospitals they built and have the proper care with the proper number of doctors, and we don't have them. And while it may be true that you work hard, and I do believe that, okay, I do. I genuinely believe that. It doesn't change the fact. It doesn't change the fact that the policies of this General Assembly have chased doctors out of this state, and there aren't enough of them. Thank you.